registered physiotherapist. Today I'd like to talk to you about some exercises specifically for strengthening the rotator cuff muscles in the shoulder. So essentially the rotator cuff muscles, they're made up of 4 different muscles. They're made up, and these are, somewhat long names, but it's made up of your supraspinatus muscle, your subscapularis, your infraspinatus, and your teres minor. And essentially the job of these rotator cuff muscles is to help stabilize the head of the humerus in the scapula area. So they're all stabilizer type muscles, and they play a major role in terms of our ability to throw a ball, to do overhead actions. They help to stabilize against things like dislocation. So a lot of times when a patient is rehabbing from dislocation, those muscles play a huge part in the stability, right, of the shoulder joint. The reason for that is the shoulder is a ball and socket joint, but it's not a very deep ball and socket joint. So we rely on these different muscles in order to, again, stabilize the head of the humerus. Also, in terms of when we have things like tendonitis of some type or bursitis in the shoulder, what will happen is, unfortunately, these muscles will become weaker, right, as a result of this inflammation occurring. And as a result of that, even when the pain is gone, what we'll find in a lot of patients is they won't have that same strength or stability or ability to do different activities that they were doing prior to the inflammation. And so again, it's really important to strengthen, right, these different rotator cuff muscles once pain is under control, essentially. So I wanted to go through again a couple exercises using what's referred to as a resistant band or a TheraBand. Excellent thing to use again when we are working on strengthening the rotator cuff muscles, because they're quite small. And we want to make sure that we're not using too great of a force in terms of the strengthening. And so in a lot of cases, these bands will come in different colors so that we can start in a very gentle sort of progression. So the first exercise I'm going to show you is essentially it's referred to as the supraspinatus rotator cuff muscle, and that's responsible for this motion here, which is called abduction. And so essentially what you do is you step on the band here, right? And typically I'll recommend for patients to go in this sort of 45-degree angle. The reason for that, and with the thumb up, and the reason for that is particularly for people who might have had an impingement syndrome, we have to work on and be really careful about the angle that you go up into. And so again, you're going to hold on to the band here, you're going to keep your elbows straight, you're going to squeeze those shoulder blades together, so again, you're opening up that space, good posture, and then you're coming straight up as far to the side as you can. Again, we want to make sure we're pain-free with that. So again, that's for the supraspinatus muscle. The the teres minor and the infraspinatus muscle, they're essentially responsible for external rotation. And so in a lot of cases, what I'll have is patients basically tie the band to a doorknob and also use a towel, a rolled up towel for the armpit area. The reason for that is in a lot of cases, we can actually cheat with certain muscles. Again, especially if we're weak, so patients will tend to overuse some of the scapular stabilizer muscles. So these would be like your rhomboids, your mid-traps, in order to do the same sort of a movement without actually rotating or doing that external rotation from the actual shoulder joint. And so again, typically I would have somebody tie the band to a doorknob, and then the action is going to be just external rotation here. And again, good posture, right? You'd have the towel there, squeeze those shoulder blades together, rotating outwards. And then for the subscapularis, you're just going to do the opposite. So again, typically this would be tied to something. You would start with, again, rolled up towel in the armpit area. You're going to squeeze that shoulder blade back, setting the scapula, setting the shoulder blade, and then you're going to go in this action again with the TheraBand. Again, you want to make sure that with these exercises that it's pain-free. Typically, this would be sort of later on in a treatment phase. depending on the specific shoulder injury. So in a lot of cases, when patients come in, there might be some pain at a very specific angle, there might be some restrictions, and so again, this would be something sort of later on in the recovery process when the patient's able to actively go into these positions against gravity pain-free. And then typically I'll have a patient do 3 sets of 10 in those different positions. And again, just making sure that, again, there's no pain with this. As always, please make sure that you check with a doctor or physiotherapist to make sure that this particular exercise is appropriate for you. And thanks again for watching. Have a great day.